Hi, welcome to today's episode of Kidstown Corner. Today's just a follow-up on our last video we did when we talked about the experiences we've seen with working with kids on their own versus working with them, with the parents in the room. We've got a great follow-up with some funny stories of things that we've seen when we've got brother or sister in the room, and how that usually goes.
Right. So we talked about how every kid's a little bit different, and sometimes it is helpful to have the parent back in the room for the dental appointment. One thing that never seems to be helpful is having a sibling back in the room, or a brother or sister. We shared kind of in the last video how some of the techniques that we'll use, how we can sometimes give kids an injection without them really even realizing it. We'll keep the needle out of their line of vision so that they never see it. We'll numb the soft tissue before we give the injection. We'll wiggle on the cheek to distract them. All of these things that we can do to distract the patient that's receiving the care. None of those things can we do for the sibling that's sitting over in the corner watching with his eyes getting this big. We can't hide the needle from him, and so he sees that and he's thinking in his mind, oh heck no, I'm never coming here.
Yeah, that's right. And Ren and I, we've seen that so many times over the years. There's been times we've got the younger or older sibling sitting over there, and they'll say something, the kid in the chair is doing great, just kind of zoned out watching the movie. I'm numbing, and from over there in the corner, is that the shot? And you're like, sure is, thanks for your help. And all of a sudden, this guy's heart rate just doubled, because now he's thinking about it.
Yeah.
And the mind is very powerful on your experience. And when you're distraction is one of our most powerful tools as pediatric dentists. Yeah. That's why we have TVs. That's why we talk about random things that you can't respond to. Like, why is the dentist always talking? I can't even talk right now. It's just distraction techniques, really. How we wiggle the cheek, like Ren was saying. Things like that it just makes your experience better. So, there's times like siblings where they're like, how come that's bleeding so much?
Yeah.
Well, luckily he's nice and numb, but sometimes that happens when I'm fixing this with the teeth or doing this. And so, you don't know when you're getting your teeth fixed, and you can't look inside your own mouth, thankfully. But when your mouth has a lot of blood supply, and so when we do things like, there's quite a bit of bleeding, a lot. Like, if you don't like blood, you don't want to be a dentist, because this is what it is. But our audience sometimes, they'll bring that up, and then that can also increase the heart rate. I've had also at the same time, I'll sometimes ask parents or siblings, like, if they're cool with this stuff. And when I say that, like, it's usually with an extraction. So, I've got the kid numb, I've got to take a tooth out, I might have an audience in here watching, and the first thing I do is I look up and I say, are you cool with this kind of stuff? And what they understand, we're understanding, right, when I say that is, does this stuff bother you? Does the sight of blood or getting a tooth pulled, is that gonna cause a problem? Because I've had people faint. Then I have two patients. I've got a patient who's laying on the floor, and I've got a patient here, and so now I've got to figure out what I want to do. So bottom line, lots of crazy stories, we could go for hours. But bottom line is we need to think and plan a little bit before we come back with the whole family.
Yeah. I've had instances where I'm working on a kid's tooth, I've got a drill in their mouth, and all of a sudden the patient's chair is knocked about 6 inches the opposite way, and it's sibling who
jumped on the bottom of the
chair, or fell against the chair, or we've had Matchbox cars come flying at us while we're trying to work on kids' teeth. So again, we're on the same team. The doctors, our staff, the parents, we all want a safe, successful appointment where we're able to get the work done, we're able to do high quality treatment, and we're able to give the patient the best experience possible. And we want the patient and we want their siblings to be excited about coming to the dentist. So let's work together and try and make these appointments as successful as possible.
Awesome, very good. Well, thanks for tuning in to today's episode of Kidstown Corner. If there are any questions or comments, please put them below. If you can think of anyone who this might benefit, share it. The more who know, the better we'll be. Awesome, thanks for tuning in.